there would be any value in this becoming part of the standard of care? So after someone has brain surgery and before they start chemo or radiation or something, would there be a value to have them referred to you just to kind of get somewhat of a baseline?
Yeah, I'm obviously very biased, so of course I'm going to say, well, for sure, but legitimately also yes. So you mentioned uh, after a diagnosis and or maybe pre-treatment to kind of get a measure of where somebody's at. I think there's a number of reasons that that could be helpful and probably should be standard of care. One of them is that, of course, with a primary brain tumor, someone's likely to have some sort of neurological sign that leads to this diagnosis. Um, but
Mhm.
that, but for the probably minority of folks who may have an incidental finding or get a workup for headaches and find that they have a brain tumor or something like that, then we can get it may not be a true baseline, right? So we may sort of accept the margin of error that okay, if we do a neuropsych testing before any kind of treatment, we know exactly when this was diagnosed, but we don't know how long it's been there. We might say, okay, well, there's a margin of error or of what's normal for for this specific person. But even in a setting like that, then that would give us a way to assess for changes down the line. And some of that ongoing monitoring could be really helpful for, like we said, predicting outcomes of treatment, predicting what aspects of cognition or functional ability might decline after treatment, and also just that monitoring that is ongoing, just like an MRI is. Someone may have serial MRIs, with a routine monitoring
Mhm.
of neuroimaging to detect potential tumor recurrence. The same thing could be potentially said for neuropsych testing, because we know that there's some evidence that declines in neurocognitive functioning could show up before a tumor is actually visible or a tumor recurrence is visible on neuroimaging. So, I mean, I would absolutely say that there are a lot of reasons that it could and probably should be considered standard of care. Insurance typically it will cover neuropsych testing,